So it's 6:30. We'll start promptly today because there's a lot to cover. Thank you very much to everyone who's already joined. This is the Academy of Nutritional Medicine, and today we have Professor Katharina Pachmann from the Maintrac laboratory in Bayreuth in Germany, talking about testing for natural substances to support cancer cell apoptosis. Professor Pachmann founded the Maintrac system of identifying circulating cancer cells using a liquid biopsy. She runs the Maintrac laboratory in Germany together with Dr. Ulrich Pachmann and a staff of 45. She's both a medical doctor and a research scientist and has been conducting studies in this field for many, many years, decades in fact, and has authored over 100 scientific publications in peer-reviewed journals on the technique. She received her PhD from the Institute for Hematology at the Society for Radiological Research in Munich and has worked at many universities since then, including the University of Jena, from where she received her professorship. And she worked, for example, at MD Anderson Cancer Center in Houston, Texas. And I'll turn the floor over to her now to talk about this very exciting topic this evening. Thank you, Katharina.
Thank you, Gillian, for introducing me. And thank you for giving me the opportunity to present to you how the Maintrac method can be used for personalized testing of natural substances to support cancer cell apoptosis.
Can I just mention one thing, Katharina, that I forgot, which is that if anybody has questions, you'll notice at the bottom of the screen there's a chat button.
Okay.
It's at the bottom of the screen, the third from the right, I think.
It's here on the top for me, yeah.
Oh, yes. Well, any viewers who would like to ask questions can click on the chat button, write their question in there, and we'll make sure to ask it afterwards. Katharina will talk for about 40 minutes, and then we'll have about 20 minutes for questions. Thank you.
Okay. So, most of you already know about the Maintrac analysis, and here is a short demonstration how we proceed to find the cells in peripheral blood and to count them and to further analyze them and to use them for chemosensitivity testing or natural substance testing. So if the blood sample arrives at our laboratory, we will lyse the red blood cells, and then we have got all the white blood cells and among them the tumor cells, and we stain all the cells with an antibody, but only the tumor cells will stain because only the tumor cells have this surface antigen EpCAM, which is typical for cancer cells. And then we put them into a 96 well plate, and the microscope automatically identifies the cells of interest in this is living, or if we do drug testing, the dead cells, and then we derive trajectory of the cell numbers over time, or we can, as mentioned, test for chemotherapy and for different other things. So we have published this with conventional drugs, but it can be used in the same way for natural substances. How does it work? If in here it's conventional drugs, if we add the drugs for different time to the cells, you can see here in the background it's white blood cells, and this is a typical tumor cell which stains for the epithelial antigen, because cancers are of epithelial origin. origin, and over time, the cell nucleus starts staining red, and this means the membrane of the cell becomes permeable, and a red dye can enter and stain the nucleus red, and this is a sign that this cell has gone into apoptosis. The same for another cell with another drug, and you can see how the cell over time dies. And here a third example with another drug, and again you can see how the cell dies over time. And that's what we use. And you might say, okay, this is in a tube. Is this relevant for the blood or for the patient? Indeed, yes, it is. We could show that the more the cells are sensitive in the tube, the more there is a reduction in circulating tumor cells. And this is also related to clinical response. If the cells are reduced or are reduced by the drug, then this is connected with a good clinical response. If they increase in spite of the drug, then this shows it's no response, and people or patients who have died are about in the same region. We did this also for a group of patients with ovarian cancer, and we could show that the cells who showed less than 50% cell killing are in the red line. So this is a so-called Kaplan-Meier plot, where you can see the more patients suffer relapse, the more the curve goes down. And these were the patients with less than 50% cell killing, and the green line were the patients with more than 50% cell killing, and they have a longer survival and relapse-free survival, and they form a plateau at about 50%. That means 50% of these patients who had been sensitive to the drugs are alive after 3 and 4 years. This is an example of such a patient. This patient received the conventional drugs used for ovarian cancer, and her cell numbers, in spite of this therapy, increased more and more in numbers, whereas down here, the sensitivity for the two drugs conventionally used for ovarian cancer were very low in cell killing. The cells did not respond lower than 50% to these two drugs. And after about half a year, the progress was also determined by imaging. And then finally the therapy was stopped, and they changed to a drug, to Celix, which we all the time had already before tested to be effective. And after they changed, in decrease. But she had this whole treatment was in vain. So she was treated, and she had all the disadvantages of chemotherapy, and it didn't help in her cancer. This is another example to show that the sensitivity of the cells, which was quite good in the beginning, decreases over time. This is an event which is well known in cancer therapy, that even drugs which have initially been very effective decrease in effectiveness over time. and the cell numbers started to go up. So we have this previously was adjuvant therapy using conventional drugs, but we can also use natural agents in a situation where the tumor has been removed. That's the adjuvant situation, and it's not known whether there are cells left in the body. What we did here is we tested a certain number of patients and looked how effective, for example, the natural agent vitamin C is. And you can see some patients show a very good reactivity against vitamin C. Some show lower, and about half of the patients show very low reactivity. So their cells are not killed by this drug. Artesunate is somewhat better, and indeed curcumin turned out to be the most effective. 75% of the patients show a good sensitivity, and it's only 25 who show not such a good effect. And this in comparison to conventional drugs like, as I mentioned before, epirubicin. You see curcumin is even more effective. It has 75 in contrast to here 52% of patients who respond well. And doxorubicin, which is known to be quite toxic, it's better than epirubicin, but still not as effective as I showed before with the curcumin. So we can test natural agents for their cytotoxicity against a specific patient's own individual cancer cell. You can also send in your own selection of agents. We require only a very small sample because we work in small volumes. Or you can select from our list of suggestions what you want to use. There are drugs which are given, or substances which are given as infusion or orally, and this can often give very different results. And we can also test mixtures in one formula of different substances. You can choose the combination, and I'll show some examples of that. So that's how it is displayed on our request form. You see here the different drug substances which we have available here in our lab. You can add further substances, and you can also sign in here what combinations you want to test. And this is for how we report then our results. So first we give here the anamnesis with how you inform us about. Here is the number of tumor suspect cells which we find per ml. This is just the calculation if we assume that the body has 5 liters of blood. And here you can see the list of these drugs or these substances which have been requested to be tested. And you see that they are quite different in their effectivity. And this, for example, was curcumin which the patient or the doctor supplied us with. And we can also test, for example, for boswellia and different substances you want us to. That's just more highlighted. Uh, you see that you can prioritize according to how effective, high the cell killing or the cell apoptosis activity of the different substances is, and then you can choose which one you want to apply. In most or in almost all cases, we find that curcumin and artemisinin are the most effective ones, but it differs from patient to patient. So it's on individual patients, it can be different. And this is a conventional chemotherapeutic drug, and these are also conventional drugs. And you see, in this case, they are lower effective than curcumin and artemisinin. You can also test combinations. This was a combination of curcumin and hypericin, and it was highly effective. We usually always test 3 different concentrations. We want to see that the effect of the substance is concentration dependent. So this quercetin in this case was very high effective already when we used it in the 10th concentration as compared to what you usually use for the patient. And we also tested 10-fold higher concentration to see the concentration dependence. And you see all of these substances are concentration dependent, although the curves can be different, starting here from a very low effectivity of a 10th-fold concentration and going up high, whereas here all the concentrations were very effective from the beginning. We present you usually with the count of the cells, and that's given as EPCAM positive cells. And some people ask, well, are you sure whether these are tumor cells? And indeed, there is no way to definitively being sure that these cells are tumor cells. There's a very recent publication was in Science in the end of 2019 showing that cells with mutations, which is assumed to be the most convincing analysis for tumor cells, that some of these mutations could even be detected in normal cells from normal tissue. So not even a mutation would be 100% sure that it's a tumor cell. So that's why we are careful and not and call them potential tumor cells. This is a case where you can see that this case was very effective and artesunate was not as effective. This can occur too. So we can test also conventional drugs versus natural substances. And here, once more, different levels of concentration for, in this case, curcumin. And this would be for the same patient, different concentrations of vitamin C. So you can ask us, and maybe then like in the previous, you could go, this would be 45 milligrams only, which is very effective already. But you see, if you use the tenfold or what is usually used, then it's more effective. But you can choose and you can define what you want to use for your patient. And then we show you how the cells respond to different treatments. And this is shown in a trajectory. And you see here at the end, there was a decrease in cell numbers. So already when the cell numbers remain stable, this is a good sign. This means that the disease is not active or very low active. And you see that this also correlated with the imaging results. As mentioned before, different combinations can also be used to increase the strength of the applied substances, and vitamin C, which was quite low, if it's given together with curcumin, it shows a higher effectivity. And here, once more, when we give you what is the best substance, and if you follow them, you can see that there is a nice response of the cells in blood to these different drugs. And here, once more, there is a very stable number of cells over quite some time, although this was already a patient who had a progressive disease in her lungs, and the previous showed quite variable cell numbers, but here over now a good time, the disease remains stable, shown by these stable cell numbers over time. Something which also is known, and I showed you before, that the same drugs can lose their effectivity over time. This is a patient where capecitabine was very effective in 2017, but in 2019, 5FU and capecitabine is the same. This is orally and this is infusion. And although it was given in infusion, it had a low effectivity at that time, which but could be increased if it was given together with curcumin. So the effectivity of different drugs, as I mentioned before, can change over time. Very often it decreases because the cells become resistant to these drugs. Something new which we have developed is the possibility to clonally expand these circulating. Not all cells in blood are capable to grow clonally, to expand. It's only a small fraction of the cells present in blood, and we can determine this fraction of cells. And what we also found is sometimes the tumor cells lose their ECM expression when they, you call it de-differentiate, but they are still capable of clonally expanding, and that's the way we can detect them. So this is a typical picture. We grow these cell clumps, these spheres, for 21 days, and they expand more and more. And indeed, I just before said sometimes the circulating tumor cells can lose their EpCAM expression, but they always regain it in these spheres. How do we proceed? It's almost the same way. We detect the tumor cells, the single tumor cells. We lyse the red blood. Then here is the white blood cells as a small clump of cells. And then we, on one hand, determine the single epithelial tumor suspect cells, or we culture them together with all the white blood cells, and over time, these clumps, these spheres, these clonal extensions develop. We have looked for how these cells, these cell spheres, how the expression is of these spheres, and it's known that certain markers are typical for stem cells, and that's CD44 plus, CD24 minus or low, and LDH positive. And indeed, these spheres express CD44 high, and this is a merge of both colors. And on the other hand, it's the same. It's not the same sphere, but it's from the same patient, and the spheres are CD24 low or almost absent, but they are EpCAM positive, and they can express a certain enzyme, the LDH, and that's typical for these cells, for the stem cells. So the spheres cultured in our system express typical stem cell markers. We can also test these spheres for their sensitivity. And here we show with conventional drugs that the circulating epithelial single cells can be very sensitive. Here, for example, for the taxanes, they are very sensitive. They are killed very well by these taxanes, less by carboplatin and epirubicin, but the spheres are very resistant to all these drugs. And surprisingly, we found that they are sensitive to a substance called salinomycin, which is an antibiotic used in animals, and again to curcumin. So salinomycin very effectively kills the tumor spheres. We have looked for selected agents, how they are against the circulating tumor cells and the tumor stem cells, these spheres. And what you can see here too is, indeed, in this patient, the number of EpCAM positive cells was lower than the number of spheres developing after growth for 21 days. And then we tested the EpCAM positive cells for different substances, in this case salinomycin, but in this patient, unfortunately, these spheres were not sensitive for salinomycin. Neither were they for shogaol. So individual tumor spheres can be or can not be sensitive to the different substances. And here you can see a sphere, how it is sensitive to the killing by curcumin. You see here the initial, this one also already is not fully stained with phoeptum, whereas this is. And after some times exposure for the curcumin, this cell sphere disintegrates, and you can see that the dying cells are in the background here too. What we can see too, and which is unfortunate too, some of the cells inside these spheres sometimes can still survive, even if most of the other cells in this sphere die. Some of them can still survive. But this is the problem with all malignant tumors, that they are so heterogeneous. We have published this. Actually, this is only one abstract. We have a publication in one of the international journals. And yeah, here once more see how this is, for example, a control sphere without any drug, without any medication added to the medium. And this is different substances, different chemo drugs. This one is not effective at all, nor is the paclitaxel nor docetaxel, both these taxanes. But here you can again see salinomycin, very effective, curcumin, very effective, also against the tumor spheres. So the conclusion is we can identify individual tumor suspect cells, characterize them, not only in the metastatic situation, but already in the primary tumor. And that's the situation where the patients can still be, you assume, cured. We can do this in a quantitative way, and we can test for the medication, which is planned for the patient to be used, and the treatment decisions can be made according to these substances and the effectivity. We are fully accredited by ILAC and DAKKS, and we are now striving to get the CE certification. I think we will have it in the first part of this year. We will achieve it. We also do recommend to use our blood collection kits. That's because the cells should be kept at ambient temperature during the shipping time. Substance which is inside here confirms that the temperature doesn't vary too much. It's the vials should be wrapped into this fleece. Then you put them into these holder, and then you put the holder into the styrofoam package, and we supply you with a paper wrapping, and then you can add the request form to it, and it arrives well with us. And this should arrive in between 48 to 72 hours at ambient temperature at our lab, and the results will be given about 5 days after we have received the sample. But as I told before, for the stem cell determination, it takes 21 hours, but you get an initial report already, and then the final report when we know how many stem cells has been growing into spheres. So thank you for your attention, and I'm open for questions.
Thank you very, very much, Professor Pachmann. That was fascinating. You said 21 hours at the end, I think accidentally. You meant 21 days.
Sorry. Yes, 21 days.
But does one receive the report on the circulating epithelial cells before that?
Yes, you receive it. If it's only counting, you receive it in about 2 to 3 days. The sensitivity testing takes 1 more day, and you get already a preliminary report after we have tested for these properties, and then we'll send you as soon as the spheres have grown, and as soon as we know how many spheres they have been grown, then you receive the final report.
Thank you. For people who may be new to this, just a quick question, please. Can you test all types of cancer with Maintrac, or are there certain types that we cannot?
Yeah. Cancer means it's from epithelial origin. But what we cannot test is blood neoplasms, like acute leukemias, lymphatic or myeloid leukemias, because the cells in these neoplasms are blood cells, so we cannot distinguish them from the normal blood cells. There are also tests available for the leukemias. And where we have a little bit of a problem is sarcomas, because most sarcomas have only partial expression of EpCAM. Mm-hmm. But we have tested quite a lot of sarcomas already, and we have been successful. And what poses also a problem sometimes are brain tumors. They are carcinomas, but there is the blood-brain barrier, mm-hmm. which may be still present, but in many or most of the brain tumors, the blood-brain barrier is deleted, so the cells can also get into blood and can be tested there.
Thank you. You mentioned that salinomycin is so very effective. I think that's probably a substance nobody has heard much about here in the UK. Is that available, and where from? Are we allowed to ask?
We have asked also. It's Dr. Szalusz in Poland who uses it, and there is a lab in Poland who produce it. So if you want to get access to it, it would be best to send me an email, and I will try to connect you to the relevant persons.
And do you have it available at your lab if people want to test their patients' cells against it? For testing,
we have it available, yes. But okay. You know, as I mentioned before, it's a small volume only, which we need for testing. So for treating patients, and Dr. Szalusz has quite a lot of experience with this already, you would need to turn to him.
All right. A lot of people here in England know about mistletoe for testing, whether Helix or Iscador, but I haven't seen that come up in your studies
No.
or in your charts. Tell us about the effectiveness of
Yeah.
mistletoe, in your opinion, or in your testing, as it were, against compared with others.
It's always helpful to test it, because in some cancers it is effective, but we know that the main effect of all the mistletoe preparations is over the immune system.
Oh, I see.
And we cannot establish the immune system in our vials, in our tubes. So we cannot really test for the effectiveness. So we only see the direct cytotoxic effect, which can be present, but we do not see the immune effect which the mistletoe has.
I see. Okay, thank you. And you mentioned the correlation between the clusters of cells and stem cells. To what extent do we have a correlation there, would you say? Is it close to 100%?
Yes, I would assume, since they have the stem cell properties, and most importantly for these cells is they can divide, they can grow, and that's the prerequisite for metastasis to develop. It must be cells that settle in foreign environment, and then they must be able to grow, and that's what we can test on these cells.
Thank
we
you.
can show that they are growing.
Thank you. And one thing we should perhaps mention is that that test has a different name. It's not Maintrac, it's StemTrac.
Yeah.
But it's still on the same requisition form.
Yeah.
And if anybody, by the way, because we may forget to mention that, if anybody is interested in finding out more about the tests or doing the tests, the Academy of Nutritional Medicine has a website, which is aonm.org, and one of the tabs on that is Maintrac. And you're very welcome to just call the helpline, and they'll give you further information. The other questions, I was just going to, I can't see any at the moment. I'm wondering whether people are attempting to write questions and not managing, because we have a good number of participants, but it's unusual that questions aren't popping up. So maybe, Martin, you could just experiment with that and check that they're coming through. Otherwise, if anybody does have questions and hasn't been able to send them through, please do send them afterwards, and we'll make sure that they're answered. We do also have a direct link with Professor Pachmann and her staff, and any questions that aren't sort of run of the mill, and there are barely any in cancer that are, can be forwarded direct to Katerina, and she does give very prompt responses, and is also very prepared to have telephone calls with you on the results if necessary and give advice, though she does have to hold back a little bit on therapeutic advice for regulatory reasons, as you can imagine. The question from one participant here is whether the results will be the same with supplemental curcumin in tablet form as well as IV?
Yeah, that's a very important question, and indeed it is not, because poorly transferred
absorbed
from the, sorry?
Did you mean absorbed?
Absorbed, yeah, from the whole digestive tract into blood. So some say it's only less than 1% of what you eat can get into blood. So the real effect, if you want to have a good effect on tumor cells which are not in the digestive tract, then you need to take it by either in IV infusion, or now there is a new formulation which is a spray which you spray into the mouth, and it should be absorbed by the epithelial lining of the mouth. And I do not yet know how well it is absorbed, but they claim that it's absorbed very well, and most of all, it's not degraded so as fast as IV curcumin.
That's very interesting. That's available in the UK now.
Is it?
Spray form of curcumin,
so
absolutely.
We are at the moment we are testing the spray form for its effectivity on the cells. We have not yet the results present yet. I think it will be available in about 1 month. Then we can have a comparison, but we cannot compensate for the absorption. So the absorption is another question which needs to be analyzed by others than us.
Obviously,
it looks quite promising.
Thank you. Another question is whether turmeric in powder form is likely to be similarly useful for cancer patients.
It's always the same thing. That is, turmeric, you can eat it, you can get it in capsules or things like that. It might be even more effective because there are different substances in it, whereas in the curcumin IV, I think there's only one substance in it. That's the requirement of the, at least in Germany. But the problem is the absorption via the intestine.
Yes, of course, and whether patients are taking omeprazole and other pharmaceuticals that prevent their uptake.
Yeah.
We have one patient, sorry, not patient, participant who would like to ask a question and has her hand up. Martin, if you can still hear me, I don't know exactly how to make that work. So if you could instruct, Martin, just speak. If you could open up your microphone and just instruct the participant as to how to make that work, that would be wonderful.
Yeah, sure. Kathy, you should be able to speak.
If she opens up her microphone, at the moment it has a red line through it.
Obviously, yeah. I don't know. I mean, she is able to speak if her microphone is on.
Kathy, are you able to speak?
No. Then I can only suggest to write the chat.
Yeah, it's a pity it's not working, Kathy, but maybe you could sketch out your question in the chat, or otherwise we can set up a time for you to speak to Katerina very soon. One question people always have here, Katerina, is to what extent, we could start with Germany, to what extent oncologists are prepared to accept these results when they come through, when the patients go with them to their doctors?
Yeah. It's developing in the right direction, according to my opinion. More and more oncologists tend to accept the results. Many physicians, general practitioners in Germany, they are allowed to treat oncologic patients. Many of them are on one hand treating the patients with conventional drugs, but they are also inclined to use natural substances or to combine them. So it's an increasing interest in using the results. It's not like 5 years ago when every oncologist used to say, ah, that's scrap, just forget about it. No, it's now increasingly accepted. And I would like to mention that we will start a study that's on conventional tamoxifen or aromatase inhibitors, but our intention is to see what happens when the patients stop the medication, because many of the patients have poor tolerance for these substances. They have sore ankles, or they have menopause symptoms. So we want to see what happens when they stop taking these drugs. And actually, our first results indicate that many of them can stop them without any problem. Cell numbers remain low or even sink, but some of them start with increasing cell numbers when they stop the endocrine treatment, and those we would recommend to restart the endocrine treatment. Obviously, their cells tend to restart growing as soon as they stop the medication, but it's only part of the patient, so we might help quite a lot of the breast cancer patients to go without endocrine treatment.
And maybe to focus on natural
Yeah.
approaches instead. Another question here is, out of your experience, what's the best nutrient herb for prostate cancer?
No, I don't have enough experience, sorry. I would need to go through our results, but I haven't it available at the moment.
Thank you.
I'm sorry.
No, that's fine. I'll just check whether any further questions have appeared. Can Maintrac be effective for squamous cell carcinomas, or is that not possible?
What is this?
Squamous cell carcinomas.
Yeah. Squamous cell carcinomas, it depends where they are. You know, the question is, some of the squamous carcinomas of the skin, they may be present, but they do not metastasize. So as long as the cell numbers, even sometimes high, remain at the same level, this is a sign that there have been released cells, but they are not growing. Other squamous cell carcinomas, like from the head and neck, may be more aggressive. And we can see this in the cell numbers, in the changes of cell numbers.
Thank you. I know we're not really allowed to talk about this here in the UK, but I'll just mention it anyway, which is that melatonin, I always pronounce it the German way because I lived in Germany for so long. Yeah. Melatonin is being discussed quite a lot. For example, Dr. Frank Schallenberger has just made a new video on how effective high dose melatonin is. Is that something you're permitted to use in Germany, and have you had any experience of testing that?
Yeah, patients who use it, and we also can look for the behavior of the cells under this treatment.
So it is apoptotic?
It can be apoptotic, yes.
So, I mean, theoretically, that could be sent in and it could be tested.
Yeah.
Great. Well, I don't see any further questions for now. As I mentioned earlier, if anybody does have questions, just send them in, probably best to info@aonm.org, and then we'll bundle them and make sure that the answers are sent to everybody who took part in this. There is another one, sorry, that I'd missed, which is, can CBD oil be tested? And indeed, can cannabis oil be tested? Again, you know, slightly difficult issues with certainly the cannabis in England, but we are allowed to use CBD oil. What's your experience there?
We can't test it because it's an oil, and as long as the oil cannot be diluted to mix with water, we cannot test it.
I see.
Because, you know, our cell culture media are water-based, and that's, it's a pity, but no, we cannot test it.
That's very interesting. Okay, thank you. Well, it's almost 7:30 anyway. We've almost been going for an hour, so I know it's later in Germany anyway, so we won't keep you for a lot longer, but just to say that we're hugely, hugely grateful. That was a fascinating hour with you, Katrina.
Thank you very
there'll be
much.
many, many more questions along these lines. Perhaps we could sort of look into the further research as it comes out. You've just mentioned studies on various different fronts that you're carrying out right now.
Yeah.
And we do have another webinar on, I believe, the 4th of February with Dr. Armin Schwarzbach. He was actually going to be doing the webinar today, and then we swapped them. His is on the IBS, that's IBS and I believe IBD, and the extent to which enteroviruses can underlie these conditions and indeed become systemic and be involved in health beyond IBS and IBD. And in fact, it is perhaps of interest that Coxsackie and echovirus are enteroviruses that he does test for, but he'll be covering others as well. So that I think will also be a very, very interesting webinar, and that will be at the beginning of February, but we'll be sending out notification about that beforehand. Katrina, maybe you and your husband would like to listen into that. I think it's going to be...
We will listen, and you know that it's increasingly, well, the first ones were cervix cancer, which are now well known, and head and neck cancers, which are virus derived, and it's assumed that some of the bacteria also can lead to a constant inflammation, which then may turn out into cancer. So I think there is a lot of connections between us.
Could I just ask one more question, which has come through via a different medium, which is it possible to tell whether increasing cell fragments over time are indicative of successful treatment or an increased immune response?
Yes, that's correct. We see, let's say, under conventional drugs, we see that if they are working, cells go into fragments, and we see the same with natural substances. Yes, a high fraction of fragmented and cell debris is an indication that the current treatment works.
That's very, very interesting. Please let us know if you'd like sample reports, because we have lots of reports shown on the PowerPoints. If you don't know what the reports look like, they're a lot fuller than what you've seen, and do talk about cell fragments as well. So we do have them available. We just don't post them on our website because really they're for therapists rather than patients. So
okay,
just let us know.
Yeah.
Okay, well, thank you very much again, Katrina.
Thanks a lot.
And look forward to hearing from you again, and also seeing you at our cancer conference later in the year, which will be in September. Further information about that will be coming around to everybody soon. And Katrina, you'll be over here. Definitely. We look forward to that. Thank you.
Thank you very much.
All the
Thank
best.
you all.
Bye-bye.
Thank you
Thank
for
you.
your attention. Bye.
Bye. Bye.